Hey there, future moms. We are your B team.
Baby team.
Yes, from Winnie Hospital for Women and Babies, we are so excited for you. Getting ready to meet your little one
is one of life's most amazing adventures. For many, that adventure begins with a scheduled induction.
So we prepared a special video presentation titled
Induction, what's your function?
Seriously?
It's just a working title.
No. What? It's kind of catchy.
Anyway, getting ready to meet your baby is one of life's greatest moments.
And we know that it comes with a lot of questions,
especially when it involves an induction.
Our goal with this video is simple:
to help you understand exactly what to expect. Over the many years in the baby business, we have received numerous questions
from mothers-to-be
regarding inductions. We've compiled the top 10 questions
to help you better understand your induction.
Now let the countdown begin.
Question 10.
Why is induction being recommended?
Oh, we get that question all the time. The most common reasons for induction are patients get to 41 weeks pregnant and they're not in labor, or anyone that has diabetes before pregnancy or was diagnosed with diabetes during pregnancy, anyone that was diagnosed with high blood pressure before pregnancy or during pregnancy. Preeclampsia, which is a condition only seen in pregnancy, is also a very common reason for induction. Then there are baby reasons as well. So if the baby's not growing appropriately or the fluid level is very low, those are two common reasons why we would need to induce based on baby's well-being.
Question 9.
What methods of induction are used?
Some of the methods of induction are determined based on your cervix. There are two pathways. If your cervix is not ready for induction process, then your whole induction will start with what's called cervical ripening, where we will prepare your cervix for labor, and that is using medication called misoprostol. It is a small pill that they will place either in between your cheek and your gum, or you will swallow, or it will be placed vaginally. The other option is a cervical ripening device. It's a little balloon that we place up through the cervix and then blow it up to help put pressure on the inside walls of the cervix and open the cervix mechanically. If your physician in the office checks your cervix and says your cervix is ready for induction, you will bypass cervical ripening because you do not need that. And you'll go straight to Pitocin through the IV. And that is the medical form of the hormone your body produces in labor called oxytocin.
Question 8.
Is pain management a part of the induction process?
Anytime we do an induction, there are a variety of pain management options for you. We have anything from IV pain medicines. We have nitrous, which is the laughing gas like you see at the dentist's office. Light therapy, water, movement, all of those are helpful, especially in the early phases of labor. And then of course we have epidurals.
Question 7.
Will induction be more painful than natural childbirth?
I get that question all the time. The induction process itself is not necessarily any more painful than actual labor, coming into labor naturally. You still are going to have the same contractions. However, the contractions may be a little closer together for a longer period of time than if you were coming in natural labor. Some of the modalities that we use to prepare the cervix for labor can be a little more uncomfortable than if you were to come in labor on your own.
Question 6.
Is walking, eating, and drinking allowed during induction?
Absolutely. I want my patients up and moving as often as they're willing. That allows the pelvis to stay open, the baby's head to come down into the pelvis. Eating, drinking, we allow that as well, especially during the cervical ripening phase. The food, the drink, that helps supply energy for your body as you move through the entire induction process.
Question 5.
Is there a higher risk of needing a C-section with an induction?
We are using these devices and these medications to help you go into labor, and some bodies will respond very easily to these medications and these mechanical forms. Some, it takes some coaxing, and then others just don't respond at all. Certainly we try our hardest because our goal is a vaginal delivery for a safe baby and a healthy mommy, but it doesn't work 100% of the time. So yes, there is a risk for C-section if it doesn't work.
Question 4.
What if the induction doesn't work?
It's not super common, but it happens. And a failed induction usually results in a cesarean section. So that is a conversation that you will have between yourself and your physician. It's not something that will be all of a sudden sprung on you. It will be hours of trying different modalities to try to get you to deliver vaginally. But if it looks like nothing's working, your physician will definitely have a conversation with you and make a shared decision on how to proceed with cesarean section.
Question 3, how is it determined if the body is ready for induction?
Once the cervix is ripened, so 2 to 3 centimeters dilated, then we consider the cervix ready. At that point, we would start a medication called Pitocin. It is IV form. That medication causes your uterus to really start to contract as if you were in labor. So to get from 2 to 3 to 10, which is our goal, you typically will need Pitocin.
Question 2, how are inductions scheduled?
Typically, an induction is scheduled through your doctor's office. Your doctor will call the scheduling coordinator at the hospital. They will come up with a day and a time that is appropriate based on your gestational age and based on your medical conditions or the complications of the baby. They will then contact you with the day and the time, either through Epic or by phone call. On the day of your induction, you will come to the hospital and check in like you would if you were going to triage. You will be admitted to the antepartum floor first. Once your cervix is ready for Pitocin, you will be moved to labor and delivery. You will check into your room. The nurses will come and put the baby on the monitor, put your uterus on the monitor, get your vital signs, start an IV, and then we'll get started after the physician comes and meets with you.
Question 1, and the final question, is a natural or unmedicated birth possible with induction?
I think it depends on what natural means to you, but an unmedicated birth is definitely possible if you're talking about pain management. We cannot induce someone without some form of medication, whether it's misoprostol or Pitocin. We've got to get your cervix ready if it's not ready, and then we have to get you into labor, and the way we get you into labor safely is through Pitocin, and it is easily controlled, and it's very quickly out of your bloodstream once we turn it off.
There you have it, the top 10 questions we get regarding inductions at Winnie Palmer Hospital.
Now, I have a question. Why are so many mothers-to-be choosing Winnie Palmer Hospital?
Answer, from the moment you walk into our doors, you're walking to a place entirely built around the miracle of life.
Our team is here with a singular purpose: to care for you and your baby with commitment and compassion.
Winnie Palmer Hospital is a place we celebrate new life every day.
And each one is special for us.
We're so honored to be a part of your new life story.
And to see you become a part of our incredible legacy.
Now you've got this, seriously.
Together we can begin your next chapter, and it starts here at Winnie Palmer Hospital.